Hello guys, this is Irayanbu. In this video we are going to see about Nocardia caviae. First, the general characteristics. Gram classification. It is gram-positive in nature and rod shape. The size generally ranges from 0.5 to 0.8 micrometer in width and 2 to 10 micrometer in length. Motility. Non-motile in nature. Capsule and endospores are absent. Aerobic growth. Requires oxygen for the growth. Optimum temperature 25 degrees Celsius to 37 degrees Celsius, and the optimum pH is 6.5 to 7.5. Habitat. Nocardia caviae is a bacterium that belongs to the genus Nocardia. Members of the genus Nocardia are commonly found in the various environmental habitats such as soil, water, decaying organic matter, rhizosphere, and the environmental diverse. Pathogenicity of the Nocardia caviae. Disease transmission. Nocardia caviae and other Nocardia species primarily causes opportunistic infection in humans. This infection are typically not transmitted directly from person to person, but rather arise from exposure of the environmental source. Incubation period 2 to 3 weeks. Virulence factors of the Nocardia caviae: capsule, cytotoxin, granulomas, biofilm formation, ability to resistance against the phagocytosis process. Pathogenesis of the Nocardia caviae. Environmental reservoirs. Nocardia caviae is found in environment, particularly in soil, water, and decaying organic matters. The bacteria establish themselves as a environmental saprophytic, playing a role in decomposition of organic materials. Entry into the host. The primary route of the entry for Nocardia is through inhalation. Inhalation of airborne spores particles such allows the bacteria to enter into the respiratory system. Nocardia caviae has a predilation for causing pulmonary infection. Once inhaled the bacteria that can establish the infection in the lungs, leading to pneumonia. The immune response may result in the formation of the granulomas. Direct contact with contaminated soil or water can lead to cutaneous infection. Skin abrasions or wound provide the entry point of the nocardia, resulting in localized skin infection abscess. Nocardia infections are known for their chronic and relapsing nature. The bacteria can evade the host immune response, resist clearance by antibiotic, and persist in the host for extended periods. Individuals with compromised immune system, such as those with HIV, AIDS, and organ transplant recipient, or individuals undergoing immunosuppressive therapy, are particularly susceptible to nocardia infection. The bacteria take advantage of the weakened immune response to establish infection. Clinical disease caused by Nocardia caviae. First, the pulmonary nocardiasis. Pulmonary nocardiasis is a umbrella term. Infection caused by the Nocardia species. The infection can affect the various organs of the body. Pulmonary nocardiasis is the most common manifestation, persisting as a respiratory infection with the symptoms such as cough, fever, difficulty in breathing. Cutaneous nocardiasis. Nocardia caviae can cause skin and soft tissue infection. Cutaneous nocardiasis may manifest as localized nodules, abscess, or cellulitis. The infection can occur through the direct inoculation of the skin or as a result of hematogenous spread from the primary respiratory infection. Systemic infection. In immunocompromised individuals, including those who with HIV and AIDS, and organ transplant recipient, or individual undergoing immunosuppressive therapy, nocardia can cause the systemic infection affecting multiple organs. Brain and central nervous system infection. In rare cases, Nocardia species, including Nocardia caviae, can cause brain and central nervous system infection. Symptoms may include headache and neurological defects. Laboratory diagnosis: Nocardia caviae. Direct microscopic examination. First, gram staining. Nocardia species appears weakly gram-positive, thin branching filamentous rod. In acid fast staining, particularly acid fast due to the presence of the mycolic acid in their cell wall. Modified acid fast staining technique like FIT method can be used. Microscopic morphology. Observation of the characteristic filamentous branching bacteria can raise suspension for Nocardia. Second, culture. Media. Nocardia grow on standard bacteriological media such as blood agar and Lowenstein-Jensen medium. Growth characteristics. Colonies may take several days to week to appear. They can be chalky, crumbly or velvety and may range the color from white to orange. Aerobic growth. Nocardia is an aerobic organism. And finally, biochemical test. Catalase test. It is generally positive for Nocardia. Urease test. Variable, typically negative. Nitrate reduction test. Variably can be positive or negative. Gelatin hydrolysis variable can be positive or negative. Indole negative, MR negative, VP negative, and finally citrate utilization test also variable. Antibiotic therapy and treatment. The combination of trimethoprim sulfamethoxazole considered as the first line treatment for Nocardia, and linezolid is an oxalidonin antibiotic that may be considered in case of resist to other agent. It has activity against some Nocardia strains. Tetracyclines may be considered as alternative against the particularly for the skin and softening tissue infection. Thank you.